This is Roadmap to Resilience, an audio series for professionals and families who are supporting children experiencing stress and trauma. I'm Dr. Julian Ford.
And I'm Dr. Amanda Zelahusky. Whether you work with children or you have children of your own, this podcast is for you.
When we experience trauma, our minds and bodies find ways to cope. What might look on the outside like spacing out, rapid mood or behavior changes, or an intense imaginary world can actually be a child psychologically disconnecting from what's happening or what has happened to them. We call this dissociation.
Dissociation is a way for children to handle experiences that are so intense that literally they can't wrap their brains around it entirely. And it's actually a very active way of protecting themselves. So in this episode, we're going to learn a good deal more about dissociation. We're going to learn why it takes place and also the ways in which it can actually be helpful to children, but the difference between dissociation and just ordinary imagination. And we'll also learn about how dissociation can have an effect on children that can be problematic if we as adults are not able to help them. But ultimately, we'll learn that there are many ways that we, parents, caregivers, providers, can help children to recover from the impact of trauma, including when they are experiencing this disconnection that we call dissociation.
Our guest on this episode is an expert on dissociation and the author of a book called The Child Survivor: Healing Developmental Trauma and Dissociation.
My name is Dr. Joyanna Silberg. I'm a clinical child psychologist, and I specialize in the assessment and the treatment of children who've undergone severe forms of trauma and often have dissociative symptoms or disorders.
Will you tell us what does dissociation in its many forms look like in children?
Well, what the word actually means is disconnection. So what we're seeing is that children who are experiencing something traumatic may need to disconnect themselves from the reality of their experiences. And the way they disconnect themselves can vary, and it can become increasingly more sophisticated to the point where even when they're teens or even young children can actually develop separate senses of self so that they feel like they're not even in an experience. For example, let's say there's a girl going back and forth between a mom and a dad. There's a divorce situation. And in one house, things are one way, and in one house, things are another way. Even a normal child who has not experienced severe trauma knows how to adjust themselves to have a different kind of a way of speaking or personality or way of talking that's appropriate for each environment. But imagine if the environments are so dramatically different that you need a whole different self to cope. Like one environment is traumatic and abusive, and one is kind and nurturing. And it doesn't have to be obviously in separated families. Such a thing could be occurring even within one home, where there could be times when things are calm and needs are met, and other times when things are not. So because of that, the child has to adapt themselves to extremely differing circumstances. And there's a disconnection between the selves as they are adapting to these separate ways of being. So the reason it's a really handy little trick is kids have to survive no matter what. They need that connection, attachment to someone. And if the only way they can do it is by cutting off a little piece of themselves so that they don't remember bad things when they're experiencing good things, then that's going to be helpful.
I wonder is it possible at times that dissociation could be mistaken for attention deficit problems and ADHD?
Very, very often. That's the first wrong diagnosis. I mean, usually when the kids have come to me, they've had 5 or 6 or 7 diagnoses before they finally get to me. And usually the first one is just the inattentive form of hyperactivity, the ADHD. But yes, because kids will tune you out when they have ADHD, and they will look as if they can't hear you whatsoever. And they are doing a very similar behavior to what the dissociative kids are doing. So that is one thing you do want to tease out as you begin to understand the child. You may want to look at situationally, how different are they in different situations? When does these spells of inattentiveness come on? Also, many of my kids have been given the diagnosis of bipolar because they do seem to have very switching moods back and forth. But it's much more useful, in my personal perspective, to understand it in terms of dissociation. Because if you understand it in terms of bipolar, it's almost like you can't do anything about it. The mood just floats over you. You get the new mood and the mood floats away. And what I'm trying to do with my dissociative kids is help them know that, yeah, the mood may float over you, but you become aware, you learn what it means, you understand how you feel, you use it as a signal to yourself, and then you learn how to move out of that mood. So it's more empowering language that I can give kids when I'm working with them, and I have this kind of a framework of the adaptiveness of it and their own ability to get some awareness of how their states are changing.
When a kid shifts from one persona to another because the situation requires that, two different households, two different settings, but it's not traumatic. It's just simply making an adjustment. It may be stressful. Is that different than when a child has experienced or is experiencing traumatic events? Do they make that same choice consciously, or does it happen without their necessarily even realizing that it's happening?
Well, even the child who is not experiencing a traumatic event is doing it, I like to use the word non-consciously, because your body and your mind work, if you're a connected person and you're healthy, kind of as one. You don't have to pre-think every single thing that you do. And so it's an automatic accommodation. But what you're pointing out is that with the more normal, adapted, happy, healthy, well-adjusted child, there's way more choice of change. So if someone says, you know what, you're really not supposed to act like that when grandma's around. We only do that when grandma's not here. She doesn't like that. Well, okay, you can make a change. So, okay, I guess she doesn't like me to use those words. Well, you know what? If you are experiencing severe trauma and you're doing this non-conscious adaptation to a different persona, that type of choice is not always there. So you can't say to the child, well, don't act like that, because that is one thing that is being lost, is that self-determination, because the brain becomes almost automatic in its adaptation because it's being signaled by the part of the brain that mediates automatic responses, the amygdala, which is heavily involved in trauma and memory of how to respond to trauma. So there's less choice, but again, it's really not particularly conscious, but it's more automatic with the more severely traumatized child. But I like to start out with normal examples of children who are adapting well, because I want people to understand it more along a continuum. Because my belief is that if you understand dissociation more along a continuum, then you're not as afraid of it. And all you need to do is to move back one little step to get closer to what's adaptive, and then move back one other little step. Because I've found kids who were adapting extremely well before the pandemic, having these brief dissociative experiences that are a response to trauma, that they're experiencing fear of illness, fear of leaving their house, and different senses of self that are more fearful than they've usually had. But what we see is they can be responsive to change in the environment and kind of fade over time. And we see that with let's say 4 and 5-year-olds who may have very developed imaginary friends, and they can take on some real help in coping with trauma, those imaginary friends. But over time, if the world gets easier for them, they kind of fade away naturally. With our traumatized kids who can't get out of that traumatic environment, those little coping tools get more and more and more rigid. And it's harder and harder to get them to kind of fade. But I don't want people to lose sight of the continuum, because it's not really always either you got it or you don't got it. It can be, hey, I see some dissociative signs of some concern. Let's try to work with that so that it doesn't take on a more pathological form.
So can we unpack that continuum a bit? Because it sounds
Sure.
like from what you're describing, we all have dissociative experiences at different times. So what does it look like to have sort of normal dissociation versus dissociation that's more problematic on your continuum?
Well, I'm going to talk, let's say, about a little boy who was developing completely normally, and he's 8 years old. And suddenly, if you say something he doesn't like, he starts looking like a cat and hissing at you. Now, if you saw that in your 3 or your 4 year old, you'd say, okay, come on, knock it off. And it could happen. You would see that kind of switch of state where they just don't want to be bothered. And so they're going to just back you away. And that's kind of a regression, but it's also a way to disconnect from the current reality and get a new way of coping where you're letting your anger express itself kind of without anybody interfering with it. So you could work with that child. Maybe you could say, hey, I see you're kind of talking to me sort of in that cat voice, like you're just really angry and you just really want to grab at me. Is there another way that you can say that? Well, that would be a way to intervene in any preschool or in any children's environment. But when you're working with a child where the dissociation has gotten so automatic and so rigid, it's not going to be as easy to use words like that. But I'm not saying don't try. You still would try. You still would say, hey, you're really growling at me. You're really thinking that, you seem like you're really mad. You're looking like a cat. And then maybe the child would say, I am a cat. Okay. And maybe as the child gets deeper and deeper into it, they'll tell you, I'm a cat and I'm here to growl at everybody and to scratch you for bothering me. And maybe the child is beginning to believe that. Now, I did a study because this was so interesting to me. What is the difference between normal imaginative play and a child who begins to get into dissociative experiences? So I actually developed an imaginary friends interview, and I compared children in the hospital that had these various persona that were taking over and making them do things they didn't want, and compare them with children who were normal children in preschools who had very vivid imaginary friends. And I found some very key differences. For one thing, the children who were in the hospital were more likely to have conflicting ones, a good little guy and a bad little guy, that they could hear the arguments in their mind. They were also more likely to be bossed by that voice in their mind, making them do something they don't want to do. And they were more likely to say they didn't like it and they wanted it to go away. Whereas the children in the preschools and kindergarten, they liked it. They thought it was fun. And the other thing was, the kids who were in the hospital when they had it, they considered it real. If you ask them, is it just your imagination or is that really there? They tended to say it was really there. It wasn't just their imagination. So there were ways that we could distinguish them. But again, it's not 100% and 100%. It's a bit of a continuum. And you look about how many of these more, let's say, pathological signs the child has in order to make a diagnosis. One of the very common signs of a dissociative process is a child who seems to be spacing out, not there, not attending. What I normally do when I'm interviewing a child like that is I ask them very specifically, hey, there was just a blank space just now. I wonder what was going on during that blank time. Did you hear something? Did you see something? What I found is that if you actually ask about it, you'll get a lot of rich information. Sometimes children may go to their own imaginary world where everything is peaceful, or they may be talking inside to inner friends, and you might find there is a more identity-based dissociation kind of a problem. Or they may be just have learned habitually that tuning out is a really good way of avoidance. I remember one young lady that I was treating, and she said, don't tell my mom I'm not dissociative anymore. When she tells me to do the dishes, I just act like I'm spacing out, but I don't want her to know I actually hear her. So there was a time when she couldn't, but as she got more control of it, it was a handy little device.
So yeah, just thinking for a second about older youth, right? Teens, even young adults, you described some of the imaginary friends and things we might see in younger kids. What are some of those examples of what it might look like in older kids?
Well, in teens, you can also see some dramatic shifts in behavior. But the thing that I would like for people to hone in on when we talk about dramatic shifts in behavior is look at dramatic shifts in relationships. And of course, teens may love and hate their mommy day one and day two, but look at dramatic shifts in other relationships, like relationships with peers or relationships with teachers, certainly relationships with parents too. Children who are dissociative often have almost inexplicable extreme shifts in the way that they relate. And often when they first come in my office, because they're kind of fearful, they're very, very clingy to a parent who might have brought them in. And when I see the child alone, I might say, do you ever feel like, even though you know you love your mom so much, there's a part of you that just wishes she would just get away? And then you can kind of interview about it and find out, yeah. And at those times, the child might even lose memory for their behavior. So the first thing I notice with teens when they're moving along that continuum of more severe dissociation is when they shift their behavior, often with an extreme affect like anger, they lose memory for what they just did. And people piece it together for them later, or they can piece it together if you give them prompts. But that's a concerning sign, the loss of autobiographical memory when you shift into a different feeling state. Now, it's not such a concerning sign to have a loss of autobiographical memory for early trauma. And I'm not trying to worry about that, certainly in the initial stages of therapy. But if you can't remember what you did yesterday, or if you called your friend and invited her to go out, and then you can't remember that you have that appointment with your friend, it can be very disruptive to teens. Or if you wreck your room, you can't remember doing it, and then you say, somebody must have come in and wrecked my room. That is really, really disturbing. And there's a lot of inner motivation to try to get control of that for kids, because it's so disorienting when they have these amnestic periods of time.
I wanted to ask you too about timing. So is it common that kids might have some of these early traumatic experiences, but not show some of these dissociative signs until much later? What does that temporal relationship look like?
It does happen, but I feel like if child therapists were a little bit more attuned, we might catch it earlier. Through my career, very often, young people were brought to me was the age of 14, kids starting in ninth grade. It seems like the pressures of so many people around, the difficulty of the work, the being put in an adult role, the feeling of lack of protection in your new high school environment seems to be like a trigger where a lot of dissociative kids would come to me. But then I would hear about their past, and they were having these dissociative signs earlier, but the parents didn't really understand or know what was going on. They thought that, they were just having a bad day, or they were depressed and didn't like to go to school, but not really putting it together as dissociation. So I do think you see it later. Now, it's important to realize, even with adult depersonalization disorder, most commonly it's described that they experienced it first when they were around 15 or 16. So rather than wait, I feel the same way about the other dissociative disorders. Rather than wait to have them come into our offices when they're adults, we really need to be looking at these kinds of signs and symptoms of younger kids and teenagers to really help them when I think their brains are so much more malleable, and they're also so much more eager to join with you and to let you know their problems when they're younger. So I say, everybody be a child therapist.
Well, I was just thinking about that with training. I wanted to ask, what do we need to do to better train mental health professionals about dissociation so that it is caught earlier?
That's an excellent question. So there are lots of training programs being offered through the ISSTD, the International Society for the Study of Trauma and Dissociation. There are year-long courses. Right now, we're on a hiatus of the year-long course, but I think it's going to start again next year. The EMDR Society also has some training related to dissociation and EMDR. And also the books. So there are some really nice textbooks. Fran Waters has a book on the fractured child. And then my book, The Child Survivor, second edition. And then for a much more theoretical understanding, we can look at Frank Putnam's book. And then there is a wonderful book of case studies that's international by Sandra Wieland with just wonderful in-depth case reports. And then there's a wonderful book that's coming out, edited by Sinison and Marks, which are studies in child dissociation. So we're getting a little bit of a library there where people can start to read some more material. Many of the major textbooks on trauma have a chapter on child dissociation. You can go to my website and look up resources and upcoming trainings. It's The Child Survivor. Look up the ISSTD website. But yes, get the training, but don't be afraid. Whenever anybody calls me now and they say, I have a case for you, I said, no, I have training for you. So you introduce the child to me. We'll do an evaluation together. I'll give you some tips. I'll supervise you. You keep your case and you learn.
Yeah.
That's what we need.
I think that's such a key, because you're exactly right. A lot of early career folks tend to be very intimidated by dissociation, especially when it comes to kids. So I appreciate you trying to push us more toward, it isn't just the disorder or that really extreme case. There are ways we see these signs in kids all across different ages and developmental stages. Is it likely when kids show some of this problematic dissociation or concerning dissociation, is it likely that that will continue into adulthood as a coping strategy?
I've had the opportunity to do long-term follow-up with the kids that I've treated when they're young, and they have not resorted back to dissociation as they've gotten older. Now, it could be, I haven't completed treatment with all the clients that I saw, and some of them probably did if they didn't get a complete treatment. We didn't get to the end. I remember one young lady that I was working with, and we thought we were totally at the end of treatment, and she had this angry self. She got into terrible trouble in her teenage years because she would just scream and threaten and then not even remember what she said to her friends. So it was years later, she's gotten a job as a nurse, and she found one of the nurses doing something completely inappropriate. And somehow she found herself yelling in that same voice. And she came to make an appointment with me. She said, it all came back. And I said, let's see, did it all come back? What did you actually say to her? She said, well, I told her that I was going to go to the boss and let them know that what she's doing is illegal and unethical. I said, so you didn't threaten to hurt her? Yes, you had that anger in you, but look how positively you used it. What we want to see is that the person will have access to the whole panoply of emotions that is in their self at the right time, in the right space, appropriately expressed, and not as a separate self without responsibility. And so I told her, yes, you did that. It felt weird because you hadn't really needed that part of yourself for a really long time. But that doesn't mean you didn't do all the work. So it's one little example.
Yeah.
I wondered if the combination of isolation and the potential intense contagion that can happen when kids, or any of us, but especially kids, are online and just picking up all kinds of information from all kinds of sources. It does seem like that would be a really powerful combination for kids just to feel confused about, am I really different people, or do I just feel different ways at different times, and I have moods, and is just helping kids and parents without minimizing the potential for dissociation, but helping them to not believe that every one of these kinds of experiences is a serious dissociative problem.
Well, another thing, as you're talking to me, what I'm thinking of is, are you just a box? Are you just a person in a box, or are you a person? Some children didn't meet their teachers, and some of my clients never met their teachers all year and just saw them in a box. Some kids did finally meet their teachers, and then they had to make the leap. Some of them distinguished between friends that were just in a box or friends that they actually knew in real life. And they would ask, and I would say, do you have any friends? And they would say, you mean Zoom, or do you mean like real people? So like, are they real people or not real people? I think that adds to both a sense of fluidity of identity and a confusion about identity and how you relate to yourself and others.
So that's really intriguing when we think about the pandemic and what that has meant for people. Do you think that that is the pandemic or time home causing increased episodes of this, or just that kids are talking about it more because of this time we're spending together, or I'm alone and isolated? What do
Well,
you think is
I
going
think
on
it's
there?
I think it's a combination of just a general level of heightened anxiety about everything that makes a little trauma feel like a bigger trauma, combined with more time alone, less time to be with peers. Now, one of the most healing things that you can do with a dissociative child is have them play with somebody who's non-dissociative, because that child has to be right there in themselves. They've got to be inside of themselves to react to that other kid really quickly. It's a very context dependent moment each time they have to change. And if they're missing those experiences, even the experiences in school, they may begin to go more and more internal. And then there's another thing that I've discovered is there are kids who are spending huge amounts of time on the internet during the pandemic. And some of them are finding websites with all kinds of interesting disorders that people have. And some of my clients were talking to people who have adults who have dissociative identity disorder and decided, well, that explains me perfectly. And then came in telling me their whole diagnosis because of spending so much time online in these self-help groups. Or some kids have traumatized themselves by finding really horrible sites online and gotten involved in really sadistic kind of imagery, which even that kind of vicarious witnessing can be very traumatic for children. So there've been a combination of reasons of why I might have seen an increase during the pandemic. All of this is here. Where do I start? That's often a question I get in my consultation. Mm-hmm. And I feel like I can find that out, even in an initial interview, where to start. There's some block that you peel and you peel and you peel, and there's some block that's making that kid feel like there's no hope and I can't go further and nothing is ever going to work. Mm-hmm. And if you can get to that, that may be where you need to start, because that's the way that you will be able to navigate around all the other things. So I do try really hard to hear where they're coming from and then use that as a roadmap to start with the area that's really blocking the progress.
And do you find that the blocks, and I'm sure that there are many and many types actually, but do they often go back to traumatic experiences or experiences of profound loss that a child just doesn't know how to come through and continue on?
I find that the blocks, or one way to look at the blocks, is that they are profound, intense beliefs about the self and what the self is capable of being or doing. So a profound sense of, I will be despised by anyone who meets me. And yes, of course, it has its roots in some early traumatic experience of feeling rejected. But I find that if you can identify it in terms of, I don't want to say that all of my work is cognitive, or that it's just, one sentence, but there is a way to get to that self-conception in words. And I often find that it's this central belief, either that one is repugnant, that I will never succeed because, or nothing is ever going to work out for me because. There's some kind of a central belief about the self that's in the way. That would be the way I look at it.
Mm-hmm. So could you tell us, how do you help, and how can parents help their children who may be dissociating to become more aware? Give us some tips on that.
Well, what I would remember, the little example I was giving you, the boy who started to be a cat. The first thing you want to do is you don't want to just criticize and correct. You want to try to join and describe in the very beginning. One of the things I like to tell children is, one way to look at your imaginary friends or those little voices you hear is your feelings talking to yourself. You have a feeling of sadness or you have a feeling of fear, but what you have is your own feelings have language to talk to you. So your feelings are talking to yourself. So we can find out what you really are feeling by talking back to your feelings and finding out. So you're feeling like you're a really vicious, mean little cat right now, and you want to growl and scratch. I think that cat is mad about something that happened. What would that cat be mad about? And then, you can begin a dialogue. And if the child wants to talk as the cat, that's fine too. So, kitty cat, what are you mad at? What's not happening good in your world? What can I get for you? But don't make the mistake of going overboard with that. Like, you don't want to bring him a bowl of milk on the ground and have him lap it up. Okay. I actually literally had that question from a parent.
Don't play along with the fantasy, but.
Right. You want to help them get descriptive language that is feeling oriented around that experience that they have of themselves. And you also might want to ask them what their view of it is. What do you think? You were talking to me like you were an 8-year-old boy, and now you're kind of talking to me like you're a little cat. What just went on? What happened? And then you can have a dialogue where you discuss it. So I would say, don't be afraid, don't correct, don't judge. Use it as a methodology of a language of feelings, a mutual language of feelings that the parent and the child can get into together to understand what the child is trying to tell them. And maybe you'll learn something that, well, I was really scared when that guy knocked on the door that he had coronavirus and you were letting him in, or whatever it is. You might find that there's some hidden feeling there that they don't want to tell you right away, because often they're embarrassed about their own feelings. Many traumatized children think they don't have a right to the kind of intensity of their own reactions. And so they feel like they can't directly say it. So you want to be welcoming of all the feelings.
They might have had enough experiences with people whose feelings were somewhat dysregulated and maybe pretty intense, and they might not want to go there themselves. But I love the way that you're saying it's as if we can help a child to bridge from saying I'm a cat to saying I'm feeling angry, and when I feel angry, I feel like a cat.
Exactly.
Now we've got a kid who knows they're there. They haven't left. They haven't become a cat, but their feelings are like those of a cat, and that's just as real. It's not taking away anything, but it's also not separating them and kind of pushing them out. Well, the cat takes over. No, the cat
Exactly. What I want to pick up on from what you said is I do that same thing with language. I slowly reshape the language of the child to be closer and closer to feelings talk. So let's say the child says, yeah, I have this part of me that's called Monster Eat You Up. I said, really? You have Monster Eat You Up? Tell me about Monster Eat You Up. He hates you. He hates everybody. Oh my, he's really mad. Could we think of calling him maybe the mad monster? And then after that, the mad John. And after that, John, when you're mad. And I just love it when then spontaneously their own language reflects the subtle ways that I've tried to change their language. Like I remember I was working with one boy, and it was 3 weeks after I had introduced this concept that the voices he was hearing in his head might be memories of bad people. And then he spontaneously said to me, instead of calling them by their names, he said, Dr. Joy, you know those memory voices you were telling me about? It was wonderful. He had a new word for them. They were memory voices. So they were no longer separate identities that were forcing him to do things that were wrong. They were memory voices. And I was just so happy to hear his language change as I had slowly introduced those concepts.
Yeah, I love that. Don't criticize and correct, join and describe. What a great, sort of tangible way to think about what you were just describing and shifting that language.
Would it be fair to say that when any of us as a parent or as a mental health provider, a pediatrician, a teacher, when we encounter a child who may be dissociating and maybe having a difficulty with that, as opposed to just being absorbed or taking a time out, that the starting place from what you're saying, Joy, correct me if I'm wrong, is talk with and listen to that child and draw that child out in gentle ways about what they're feeling. And through those feelings, then it can become much more apparent where the lapses are occurring and why they're going away, or why someone else, another persona, seems to be stepping in. But it all goes back to just clarifying and helping the child to begin to clarify and express what they're feeling.
Yes. And if the parent feels over their head, go to a trauma specialist and have that interviewing done there. But don't be so afraid to find out what the child is trying to tell you. And understand it as another language. People talk in many languages. One language to talk in is the language of change of self and state. That's another way that feelings can be expressed. So we can use that language to help go into the world to understand how they're expressing themselves.
So I learned so much from Dr. Silberg in this episode. Just a lot of times in mental health, when we think about working with kids who have experienced trauma or we're training others to do so, dissociation can have just such a negative connotation, and people immediately fear it and think that they need to get rid of it, right? In ways that people are coping with traumatic experiences. So one of the things I really appreciated hearing from Dr. Silberg was about how actually sometimes dissociation, especially in young children and adolescents, can be protective, can be helpful, is not necessarily a bad thing that we immediately need to figure out how to get rid of. I really appreciated learning how to distinguish between the different types of dissociation, the levels of severity, and how it can show up for kids in different ways. So I learned a lot about how dissociation can just, show up in many different forms.
And I couldn't agree with you more, Amanda, that this was really enlightening, because dissociation can seem very scary, like something terrible is happening, when in fact, from Dr. Silberg's presentation, it's clear that this is something that children do to protect themselves, and we can actually help them with that. So if you suspect that your child is experiencing dissociative symptoms that might be a problem, consider connecting with a mental health provider who could help you develop a plan of action.
Many thanks to our guest expert on this episode, Dr. Joyanna Silberg.
Visit roadmaptoresilience.org to learn more about our guest experts, access additional videos and resources, or send us a message.
If this episode piqued your interest, we'd love for you to leave a 5-star review on Apple Podcasts and let us know what you think. And if you imagine this episode would resonate with a colleague or friend, please share it.
Roadmap to Resilience is a collaboration between Pandemic Parenting and the University of Connecticut School of Medicine, with special thanks to the Interorganizational Child Trauma Task Force.
Roadmap to Resilience is produced by my co-hosts, Dr. Julian Ford, myself, Dr. Amanda Zelahusky, along with Carmen Vincent and Victoria Bruick. Many thanks to Jennifer Valentine for her strategic support, and to the teams at Pandemic Parenting and the Center for the Treatment of Developmental Trauma Disorders for providing promotional support.
We'd also like to thank the Substance Abuse and Mental Health Services Administration's National Child Traumatic Stress Network for their financial support of this project.
Thank you for joining us in supporting children in need of a roadmap to resilience.